What if I told you that the real reason many diabetics end up on dialysis is not sugar alone, but certain foods they eat every single morning without fear, foods they have been eating for decades, foods sitting in their kitchen right now, foods that are marketed as healthy, as natural, as good for you, while silently, systematically destroying the most fragile and irreplaceable filters in the human body? I am Dr. Richard K. Bernstein. I have been treating diabetic patients for decades. I have had type 1 diabetes myself since I was a child, and in all my years of practice, one of the most painful conversations I have ever had, repeated more times than I can count, is sitting across from a patient and explaining that their kidney function has declined significantly, not because they ignored their diabetes, not because they were careless, but because nobody ever told them the truth about what they were eating every day. Today I am going to tell you that truth. I am going to show you the 7 everyday foods that are silently destroying diabetic kidneys after age 50, and I am going to show you the shocking truth about breakfast, a meal that millions of diabetics believe is safe, even beneficial, that is quietly accelerating kidney damage in ways that most doctors never explain clearly enough. Stay with me through every single one of these, because number one, the food at the very top of this list is something that almost every diabetic over 50 is eating right now. And when you hear what it does to your kidneys at the cellular level, you will never look at it the same way again. Before I reveal the list, I need you to understand something about diabetic kidneys that most people, and frankly, many doctors, do not explain clearly enough. Your kidneys are not simply filters. That description, while technically accurate, dramatically understates what they do and how vulnerable they are. Each kidney contains approximately 1 million tiny filtering units called nephrons. Each nephron contains a microscopic cluster of blood vessels called a glomerulus. These glomeruli are so delicate, so precisely engineered, that they can filter your entire blood supply, roughly 5 liters, every single minute of every single day of your life. Now, here is what diabetes does to these structures. High blood sugar, over time, damages the walls of the tiny blood vessels inside each glomerulus. The damage causes these vessel walls to become leaky, allowing proteins that should stay in the blood to spill into the urine. It also causes them to become scarred and thickened, reducing the filtration surface area. And as nephrons are damaged, they do not regenerate, they do not repair, they are simply gone. And the remaining nephrons take on additional load, accelerating their own decline. This process is called diabetic nephropathy, and it is the leading cause of kidney failure in the United States. But here is what most patients are never told clearly. Diet, specifically certain foods, dramatically accelerates this process, not through blood sugar alone, through multiple separate mechanisms that pile damage onto kidneys that are already under pressure: protein load, phosphorus toxicity, sodium-driven hypertension, inflammatory acid load, oxidative stress. Each of the 7 foods I'm about to show you damages diabetic kidneys through one or more of these mechanisms, some through all of them simultaneously. And the tragedy, the true tragedy, is that most of these foods are considered perfectly healthy by mainstream nutritional guidelines. They appear on diabetes-friendly food lists. They are recommended by well-meaning family members. They are eaten for breakfast, lunch, and dinner by people who believe they are taking care of themselves. This is what I want to change today. Food number 7. Processed lunch meats and deli meats, ham, turkey slices, salami, bologna, the things that go between bread or crackers, the things that seem like a reasonable quick protein source for a diabetic who is trying to avoid carbohydrates, I understand why diabetic patients reach for these foods. They are convenient, they are low in carbohydrates, they feel like a safe choice when you are trying to manage blood sugar. But what processed deli meats contain, in amounts that are genuinely alarming when you look at them carefully, is sodium and phosphorus and preservative compounds that place a significant inflammatory burden on already stressed kidneys. A single 2-ounce serving of processed turkey deli meat can contain anywhere from 400 to 700 milligrams of sodium. Most people eat significantly more than 2 ounces. And for a diabetic kidney, a kidney already working under the strain of years of elevated blood sugar, that sodium load triggers a very specific and damaging chain of events. Sodium causes the body to retain water. Water retention raises blood volume. Raised blood volume increases the pressure inside those delicate glomerular blood vessels, and sustained elevated pressure inside the glomeruli, a condition called glomerular hypertension, is one of the most well-documented mechanisms of accelerated kidney damage in diabetes. Think of it this way. Your glomeruli are microscopic. Their vessel walls are extraordinarily thin. They are designed to handle the normal pressure of healthy circulation. When pressure rises, day after day, meal after meal, those walls begin to stretch, they begin to leak, they begin to scar, and once they scar, they do not come back. The phosphorus in processed meats adds a second layer of danger. In healthy kidneys, excess phosphorus is filtered and excreted. In damaged diabetic kidneys, that filtration is impaired. Phosphorus builds up in the blood, and elevated blood phosphorus has been directly linked to accelerated kidney function decline, cardiovascular damage, and increased mortality in patients with chronic kidney disease. And the preservatives, the sodium nitrate, the sodium nitrite compounds used to extend shelf life, generate inflammatory compounds in the body that have been shown to increase oxidative stress in kidney tissue directly. This is not the food it appears to be. For a diabetic kidney, every serving of processed deli meat is a small but real insult, and small insults repeated daily over months and years become irreversible damage. But the next food on this list surprises people far more because it carries one of the most misleading health halos of any food in the American diet. Food number 6, bottled salad dressings, especially the low-fat varieties. I know how this sounds. Salad. How could salad be dangerous for your kidneys? The salad itself is not the problem. The dressing is. When food manufacturers remove fat from a product, they face an immediate problem. Fat carries flavor. Without fat, food tastes flat, bland, unpleasant. The solution, the industrial solution used consistently across the processed food industry, is to replace lost flavor with sodium, sugar, and artificial flavor compounds. A single 2-tablespoon serving of a popular low-fat ranch dressing contains over 300 milligrams of sodium. Most people use 3, 4, sometimes 5 tablespoons on a salad. That single healthy-seeming lunch addition can deliver 700 to 900 milligrams of sodium before you have eaten anything else. But beyond the sodium problem, many commercial salad dressings contain high fructose corn syrup or other rapidly absorbed sugars, even the ones that do not taste particularly sweet. These sugars spike blood glucose. Spiked blood glucose increases a sugar load passing through your kidney filters, and repeated glucose spikes over time directly accelerate glomerular damage through the mechanisms I described earlier. There is also something in many bottled dressings that almost no one talks about in the context of kidney health, and that is the phosphoric acid and phosphate additives used as preservatives and flavor enhancers. These synthetic phosphate compounds are absorbed by the body at a much higher rate than the naturally occurring phosphorus in whole foods, And in a diabetic kidney already struggling with phosphorus management, that additional synthetic phosphorus load is genuinely harmful. The patient who believes they are eating healthfully because their plate is full of vegetables while pouring a commercially produced low-fat dressing over everything is making a choice that feels protective but is silently working against them. The solution is not to stop eating salad. The solution is to dress it properly. Olive oil, a small amount of apple cider vinegar, or fresh lemon juice, fresh herbs, real food, no bottle required. What doctors rarely explain is how much damage accumulates, not from one bad meal, but from the daily, repeated, trusted habits that nobody ever questions. And the next food on this list is one of the most trusted habits in American breakfast culture. Food number 5, orange juice and fruit juices, including the ones labeled 100% natural. This one is painful to discuss because orange juice in particular carries such a deeply positive cultural image. It is breakfast, it is vitamins, it is naturalness, it is the glass on the table in every happy family advertisement. And for diabetic kidneys after age 50, it is a significant and repeated source of damage. Here is what happens when a diabetic drinks a standard 8-ounce glass of orange juice. Approximately 26 grams of sugar, mostly fructose and glucose, enter the bloodstream with almost no fiber to slow their absorption. Blood sugar rises rapidly and sharply. The pancreas, already stressed in a diabetic, attempts to respond. Insulin is either insufficient or absent depending on the type and severity of the diabetes. The kidneys, flooded with high concentration glucose in the blood, begin filtering that glucose under elevated pressure. Every glucose spike is a pressure event inside the glomeruli. Every pressure event causes microscopic stress on those vessel walls, repeated daily, every morning, for years. But the fructose component deserves separate attention because fructose metabolism affects the kidneys through a mechanism that most people have never heard of. Unlike glucose, fructose is metabolized almost entirely in the liver. One of the byproducts of fructose metabolism is uric acid. Elevated uric acid, a condition many people know as gout, also directly damages the kidneys. It causes inflammatory crystals to form in kidney tissue. It raises blood pressure through a specific hormonal pathway, and it accelerates the scarring of glomerular tissue in ways that are additive on top of the damage already being done by hyperglycemia. High fructose fruit juice, consumed daily by a diabetic over 50 who believes they are making a healthy choice, is delivering blood sugar spikes, uric acid elevation, and glomerular pressure events every single morning to kidneys that have no capacity to absorb that repeated damage without consequence. 100% natural, 100% harmful for this specific population. Stay with me, because foods number 4 and 3 are the ones that my patients are most shocked to learn about. They are foods that appear specifically on diabetes-friendly food lists, foods that are genuinely recommended by well-meaning healthcare providers, and foods that are accelerating kidney damage in ways that those recommendations have not accounted for. Food number 4, high-protein shakes and protein supplements, especially whey protein. Protein supplementation has become enormously popular in the health and fitness world, and in the diabetes community specifically, there has been a significant shift toward high protein eating as a way to reduce carbohydrates and manage blood sugar. This is not entirely wrong. Reducing carbohydrates is genuinely important for diabetic blood sugar control. I have advocated for this approach throughout my career, but there is a critical and often overlooked distinction between adequate protein intake and excessive protein intake. And for diabetic kidneys, that distinction is not minor. It is potentially the difference between decades of kidney function and an early decline into kidney failure. Here's the mechanism. When you consume protein, your kidneys must filter the byproducts of protein metabolism, primarily urea and creatinine, out of the blood. The more protein consumed, the more filtration work required. In a healthy kidney, this additional workload is manageable. In a diabetic kidney, already compromised, already working at reduced capacity, it accelerates the loss of nephrons. This increased filtration demand is called hyperfiltration. And hyperfiltration, paradoxically, damages kidneys not by underworking them, but by overworking them. The glomeruli, forced to filter at higher rates and pressures than they are designed to sustain, develop micro tears in their vessel walls. Those micro tears become scarring. That scarring becomes permanent reduction in filtration capacity. A single protein shake can deliver 25 to 50 grams of protein in minutes. The average diabetic over 50 who is following a low-carb approach may already be consuming significant protein from their meals. Adding 1 or 2 protein shakes per day, in the belief that more protein means more protection, can push total daily protein intake to levels that are genuinely harmful for a kidney under diabetic stress. Whey protein specifically has been shown to cause a more pronounced hyperfiltration response than protein from whole food sources. Its rapid absorption rate, the feature that makes it popular for muscle recovery, also means the kidneys receive the full protein metabolic load in a compressed time frame, creating sharper filtration spikes than a meal of equivalent protein delivered through whole food would produce. If you are currently using protein shakes as a regular part of your daily diet and you have diabetes, especially if you are over 50, this is a conversation you need to have with your nephrologist or your primary care physician at your next appointment. The question is not whether protein matters. The question is how much is too much for your specific level of kidney function right now, today. Food number 3, canned soups and canned vegetables, including the ones marketed as healthy, low-calorie, and diet-friendly. The can is the problem, not entirely, but significantly. Canned foods, to maintain shelf stability and palatability over months and years of storage, require substantial amounts of sodium. Even a single can of a popular tomato-based soup, the kind sold specifically as a light healthy option, can contain 800 to 1,400 milligrams of sodium. Some canned soups exceed 1,400 milligrams per serving, and most cans contain 2 servings, meaning a person who eats the full can consumes the equivalent of an entire day's recommended sodium allowance in one meal. For a diabetic kidney, this sodium load creates the glomerular hypertension problem I described earlier. But canned foods also contain something beyond sodium that most people have never considered in a kidney health context. Bisphenol A, commonly known as BPA, is a chemical compound used in the lining of most metal food cans to prevent corrosion. BPA is an endocrine-disrupting compound. It mimics estrogen in the body and interferes with hormonal signaling systems. Research has consistently shown that BPA exposure is associated with elevated blood pressure, insulin resistance, and direct kidney toxicity at levels of exposure that are entirely consistent with regular consumption of canned foods. The diabetic patient who is carefully watching their carbohydrates, carefully avoiding sugar, carefully trying to eat sensibly, and who is doing it by relying on canned soups and canned vegetables as convenient, healthy options, may be exposing their kidneys to a chemical burden that their endocrinologist has never discussed with them. Not because that endocrinologist doesn't care, but because the intersection of environmental chemical exposure and diabetic kidney disease is not yet part of standard diabetes education in most clinical settings. This is where the real danger hides. not in the obvious places, in the trusted, convenient, well-meaning choices that nobody has ever thought to question. We are down to the final two. And I want you to understand these are the most common, the most widely consumed, the ones that are present in more diabetic households than any other food on this list, and the ones causing the most cumulative damage quietly every single day. Food number 2, whole wheat bread and whole grain products, including cereals, crackers, and granola bars. I know this will be difficult to hear. Whole wheat bread has been recommended to diabetic patients for decades. It is on virtually every diabetes-friendly food list ever published. It is presented as the responsible alternative to white bread, the fiber, the nutrients, the slower digestion. And for a person without diabetes, whole wheat bread is indeed a better choice than white bread. For a diabetic, particularly after age 50, whole wheat bread is not a safe food, and for diabetic kidneys, it carries a burden that its nutritional reputation completely obscures. Here is the reality. Whole wheat bread, regardless of the fiber content, is a dense carbohydrate food. A standard 2-slice serving of whole wheat bread delivers 24 to 30 grams of carbohydrates, nearly all of which convert to glucose in the bloodstream within 30 to 60 minutes of eating. In a diabetic, this reliably produces a meaningful blood sugar spike. That spike is the direct driver of glomerular damage I have described throughout this video. The fiber in whole wheat does slow digestion slightly compared to white bread. Slightly, not enough, not nearly enough to prevent the glucose spike that damages kidneys. The difference between the blood sugar response to white bread and the blood sugar response to whole wheat bread in a diabetic patient is, in clinical terms, relatively modest. But the kidney danger of whole wheat goes beyond blood sugar. Whole wheat and whole grain products are among the highest dietary sources of phosphorus in the American diet. And critically, the phosphorus in grains is bound in a compound called phytic acid, which reduces but does not eliminate its absorption. Whole grain cereals, granola, whole wheat crackers, eaten daily as part of a conscientious diabetes management approach, deliver meaningful phosphorus loads to kidneys that are already struggling to manage phosphorus excretion. Whole grain cereals, specifically the ones with the heart-healthy labels and the fiber claims, are also frequently high in potassium. And for a diabetic kidney with reduced filtration capacity, elevated blood potassium, hyperkalemia, is a serious and potentially life-threatening concern. The kidney that cannot properly excrete potassium allows it to build up in the blood. Elevated blood potassium disrupts the electrical signaling of the heart. It can cause irregular heartbeat. In severe cases, it can cause cardiac arrest. This is what whole wheat bread does not tell you on its label. This is what the Heart Healthy logo does not disclose. And now, food number 1, the food at the top of this list, the one I promised would surprise you. The one that is present in more diabetic kitchens after age 50 than any other food I will mention today. Food number 1, dairy, specifically regular cow's milk, flavored yogurts, and processed cheese products. Let me be very precise here, because dairy is a complex category, and I do not want to create unnecessary confusion. The specific problem is not all dairy. The specific problem is the combination of high phosphorus content, inflammatory protein compounds, and in the case of flavored yogurts and processed cheeses, extremely high sodium and added sugar, all converging in foods that are consumed daily in large amounts by diabetic patients who have been told they are healthy choices. An 8-ounce glass of cow's milk contains approximately 230 milligrams of phosphorus. A cup of flavored yogurt the kind marketed as a healthy protein-rich breakfast, can contain 300 to 400 milligrams of phosphorus plus 20 to 30 grams of added sugar plus significant sodium. Processed cheese slices, the individually wrapped kind, are manufactured with phosphate additives that increase their phosphorus content well beyond what naturally occurring cheese would provide. Daily consumption of these foods, a glass of milk with breakfast, a yogurt as a morning snack, a slice or two of processed cheese with lunch, can easily deliver 600 to 900 milligrams of phosphorus before dinner. In a diabetic kidney with reduced filtration capacity, this sustained phosphorus load has documented consequences. It raises blood phosphorus levels. Elevated blood phosphorus triggers the release of a hormone called FGF23, fibroblast growth factor 23, which in turn causes secondary hyperparathyroidism. This hormonal cascade pulls calcium from bones, deposits it in blood vessels, and has been directly linked to accelerated kidney function decline and cardiovascular death in patients with chronic kidney disease. This is a real biological pathway. It is well documented in the nephrology literature, and it is being triggered in millions of diabetic patients over 50 every single morning by a glass of milk and a cup of yogurt that they have been eating faithfully, believing it is good for their bones, good for their health, good for their body. The flavored yogurt with the live cultures and the protein content and the low-fat label, the milk that has been part of breakfast since childhood, the processed cheese that makes a meal feel complete. These are the foods doing the most damage, not because they are inherently evil, but because they are consumed daily in large amounts by people who have never been told about the phosphorus burden, the sugar spikes, the sodium accumulation, by people whose kidneys are already under diabetic stress and cannot absorb these repeated insults without consequence. I want to spend a moment now talking about what this information should feel like and what it should not feel like. It should not feel like paralysis. It should not feel like everything is dangerous and nothing is safe. That is not the message. That is not the truth. The truth is that your kidneys, even damaged kidneys, respond to change. Not immediately, not dramatically, but consistently and measurably over time. Reduced phosphorus intake lowers blood phosphorus levels. Reduced sodium intake decreases glomerular hypertension. Reduced carbohydrate intake decreases glucose spikes and reduces the filtration burden on every nephron you have left. The kidneys cannot regenerate lost nephrons, that is true, but they can and do stabilize when the stressors driving their decline are removed or reduced. I have seen patients in my practice whose kidney function, measured by GFR, glomerular filtration rate, plateaued and remained stable for years after meaningful dietary changes, not improved dramatically, stabilized, which in the context of a progressive disease is an enormously meaningful outcome. The goal is not perfection. The goal is to stop the daily accumulated trusted damage, to replace the foods on this list gradually, thoughtfully, with your physician's guidance, with foods that do not place these specific burdens on your kidneys. Foods that are low in phosphorus, low in sodium, low in rapidly absorbed carbohydrates, anti-inflammatory, kidney protective, eggs, prepared simply without processed additions, fresh vegetables, particularly leafy greens and cruciferous vegetables, dressed with olive oil rather than commercial dressings, fatty fish like salmon and mackerel, which provide omega-3 fatty acids with documented kidney protective properties. Cauliflower, one of the most kidney-friendly foods available, low in phosphorus, low in potassium, extraordinarily versatile. Berries, particularly blueberries, which deliver antioxidants with documented protective effects on vascular endothelium, without the fructose load of juice. These are not exotic foods. They are not expensive. They are not difficult to prepare. They are real, whole, unprocessed foods that your kidneys can handle without the burden that the 7 foods I described impose. I want to tell you about a patient I will call Dorothy. Dorothy was 68 years old when she came to me. She had been managing type 2 diabetes for 14 years. She was careful. She read labels. She followed dietary guidelines faithfully. She ate whole wheat toast for breakfast with a glass of orange juice. She had flavored yogurt as her morning snack. She used low-fat dressing on the large salad she made for lunch. She had soup from a can, always the healthy, low-calorie kind, several times a week. She used protein powder in her afternoon smoothie because she had read that protein was important for managing blood sugar. By every visible measure, Dorothy was doing the right things. She was not eating candy. She was not drinking soda. She was not ignoring her diabetes. When I reviewed her blood work, her GFR, the measure of how well her kidneys were filtering, had declined from 72 to 48 over the previous 3 years. Phosphorus slightly elevated, uric acid elevated, blood pressure creeping upward despite medication, early signs of the decline that, if left unchecked, leads to dialysis. We sat together and went through her diet, food by food, not to frighten her, but to show her specifically and clearly what was happening and why. She was not eating badly. She was eating according to the best information she had been given, and that information was not adequate for her kidneys. Over the following 18 months, Dorothy replaced her orange juice with water and a handful of blueberries. She replaced her flavored yogurt with 2 soft-boiled eggs. She replaced her canned soups with homemade vegetable broth. She replaced her commercial salad dressing with olive oil and lemon. She stopped using protein powder. Her GFR at 18 months, 54, improved from 48. Her phosphorus normalized. Her uric acid decreased. Her blood pressure stabilized without an increase in medication. These are not dramatic numbers. They are not a cure. But they represent a kidney that stopped declining, a kidney that was given the conditions it needed to stabilize. Dorothy told me at that appointment that she wished she had known these things 10 years earlier, not with anger, with quiet, determined resolve. I am telling you now, so that your 10 years from now looks different from hers. Let me give you something practical and concrete before we close today. If you want to begin protecting your kidneys starting today, starting with your very next meal, here is a simple framework. Remove 1 food from this list per week, not all 7 at once, 1 at a time. Choose the one you consume most frequently and begin replacing it. Give yourself 1 week to make that single substitution feel natural before addressing the next. Week 1 might be replacing commercial salad dressing with olive oil and lemon. Week 2 might be replacing canned soup with a homemade alternative or a low-sodium option with fresh vegetables added. Week 3 might be replacing flavored yogurt with eggs, small, consistent, manageable changes sustained over weeks and months. This is how dietary transformation actually happens, not through dramatic overnight overhauls that last 3 days and then collapse under the weight of their own demands. At the same time, I want you to request specific kidney health markers at your next physician appointment if you do not already have them. Your GFR, glomerular filtration rate, your serum creatinine, your serum phosphorus, your urine albumin to creatinine ratio, which is the most sensitive early indicator of glomerular damage available. These numbers tell you where your kidneys are right now. They give you a baseline against which to measure the impact of your dietary changes over time. Knowledge of your numbers is not frightening. It is protective. It is the difference between catching a decline early, when it can be stabilized, and discovering it late, when options are more limited. There is one more thing I want to say directly to you before we end today. If you have been eating these foods, if you recognize yourself in this list, please do not respond to that recognition with guilt or with fear. That is not the purpose of this information. That is not what I want you to take from this video. You ate these foods because you were told they were safe, because the labels said healthy, because the guidelines recommended them, because the people who love you encouraged them. You were not being careless. You were doing your best with the information you had. Now you have better information, and that is genuinely, meaningfully powerful, because the kidneys, unlike many organs, do respond to reduced burden. They do stabilize when the chronic insults are removed. They do give you more time, more function, more life when they are given the conditions to do so. You are not too late. You are not beyond the point where your choices matter. Every meal from this point forward is an opportunity, not for perfection, for improvement. Small, consistent, sustainable improvement that accumulates over months and years into preserved kidney function, into avoided dialysis, into more years of mobility, independence, and the life you want to be living. That is what this information is for, and that is what I want for every person watching this today. I want to ask you something before you go. Which food on this list surprised you most? Which one did you not know about, or which one are you eating right now that you did not realize was dangerous for your kidneys? Tell me in the comments below. I read them. And your answer shapes the content I bring to this channel so that I can keep giving you the specific, honest, clinically grounded information that actually makes a difference. If this video helped you today, if it showed you something you needed to know, please share it with your spouse, with your parent, with the friend who has diabetes and does not yet know what their morning yogurt and orange juice are doing to their kidneys. One share from you could change the trajectory of someone's kidney health. That is not a small thing. And if you have not subscribed yet, please do, because what I teach here is not what you hear at a routine checkup. This is the deeper knowledge, the honest knowledge, the kind that protects the people who receive it. Take care of yourself, protect your kidneys, and I will see you in the next video.